Thank you, Kim and the chair. It's hard to make the bridge after such an introduction from warming up to back our nutritional topics, but I'll try. Thanks, Natalia and the chairs, for giving me the opportunity to participate in such a stimulating workshop. It's really a great opportunity for me. First, I was a little bit surprised when I found the vegan diet topic under the session of the role of milk in early life, because milk doesn't take a place in vegan diet. But however, I think it fits very well to discuss potential chances and risks if somebody departs of a well-established feeding pattern, what milk is in young children. So, if we talk about veganism, then we talk about the growing topic. At last, in high and middle income countries, there's a clear trend towards the interest of this dietary form. This is mirrored very nicely in the graph of Google Trends during the last years. However, when I search for the term healthy nutrition, that seems to interest people over the last decades. And when I had a closer look at the curve, I realized that these peaks rise up in January, just after Christmas and New Year's. So probably there's something seasonal, I realized. However, trends in a society are pretty fast taken as well by the market, shown here by the sales of vegetarian and vegan foods, milk and meat alternatives for Germany over the last years. This also implies that the offer of such foods will sometimes, with sometimes fortified and supplemented products, will enlarge the market for people choosing vegan diet. And this is very important if we go back to studies, because the environment, what you can buy and afford, changed much over the last years. In this talk, I will shortly go over types of the most prevalent restricted diets and then focus on the question on impact on health of vegan diet. Finally, we go through international recommendations and compare them. As you all know, as being pediatricians as well, as a basic principle, we have to keep in mind that the more restricted the diet is, the bigger the risk of malnutrition and or deficiency would be. And as well as the younger the child, because of the relative higher amount of nutrients compared to the adult, the bigger the risk for malnutrition would be as well. I will show you a short definition. I'm sure that you are already aware of these definitions as far as they are consistent. The mixed diet is based on a diversified choice of plant-based and animal-based food sources, and the meat is consumed, as definition, more than once a week, whereas the flexitarian eats meat and fish or fish less than once a week. There are different forms of vegetarian diets without egg or milk, and when we talk about vegan, they avoid all products of animal origin, including honey. There exist also different subforms of vegan diets, like the macrobiotic or raw food diets. Into this presentation, I don't want to go into these subforms. The next slide as well is, first I just want to come back to something which is very basic, but I think if we talk about restricted diet, it's very important just to keep in mind. What does a healthy nutrition mean for a childhood? So it's obvious. Optimal food should allow the child to grow and thrive healthy, here reflected by the growth percentiles. Furthermore, an optimal diet supports and allows a child his psychomotor and intellectual development. This is already more influenced by different factors, as we heard already. But healthy diet should also avoid diseases as well in short term, and more important in long term, here reflected by the so-called non-communicable diseases like cancer, cardiovascular disease, or the metabolic syndrome. But I think nutrition is more. Nutrition and eating means being together, being in a place together, recreation and social contacts, which I think is very, very important to teach and achieve as well. How can these goals be reached? First of all, we must have enough food in regards of quantity and quality. The diet should provide a child with an optimal coverage of micronutrients. And as we heard so far, this is not so easy to define and then to change. And last but not least, there's a need of family and social structures to exemplify a healthy way of life, and this doesn't just apply for nutrition. Being a pediatrician, I would just show you some examples how I can be confronted to the situation of a vegan diet as a pediatrician. It can be the mother in a regular control of 12 months with her healthy infant, with a question whether she should feed her infant with a vegan diet as she does for herself. Or it can be the situation completely different in my consultation for an adolescent who has a diagnosis of functional abdominal pain or irritable bowel disease, who already choose for herself a mainly gluten and cow's milk-free diet, and now raises the question whether an extent on a vegan diet would help to improve her symptoms. Or a third, completely different situation we would like to avoid in every circumstances would be the admission of a nine-month-old infant with failure to thrive, retardation in development with microcephaly, different deficiency like anemia, zinc, vitamin D deficiency from a child, breastfed from a mother on a vegan diet. I'll come back to this situation at the end of the talk. As already mentioned, I had a chance to participate between 2016 and 2018 in an expert panel reviewing the question of benefits and risks of a vegan diet. The report serves the Federal Commission of Nutrition as a base for nutritional recommendation for the Swiss population. To put the acceptance of such a report on a broad base, it was important and helpful to incorporate representatives from different fields. So, for example, as well from national vegan societies itself. For the content and reference of this presentation, I based myself mostly on this 80-page report. When we talk about prevalence of the vegan diet, there are unfortunately no reliable numbers available, especially not for kids. A Swiss survey performed 2 years ago in adults found that about 3% of the study population followed a vegan diet. These were mostly young adults, well-educated, it was equally distributed in both sexes, and this is important if we talk about long-term outcome. Most of them followed the vegan diet just for a short term, most of them about under 2 years. In kids, as I mentioned, we don't have any numbers. German survey done in adolescents found about, in average, 4% of the adolescents following a vegetarian diet. And when I tried to look for numbers worldwide, I followed on Wikipedia, and I'd like to show you this world map where we have different prevalences of vegetarianism. This is not vegan diet, but a vegetarian diet, and as we already heard, it's very, very prevalent here in India. However, I didn't find reliable numbers on vegan diet in different areas of the world, and we conclude that in the Western world, about 0.5 to 3% of the population would follow a vegan diet. But what is important, especially for us, is that this percentage is on the rise. When we look at these trends, the question is important: why somebody decides to follow a vegan diet or even a lifestyle of a vegan diet. As pediatricians, we focus mostly on the health, whereas, for example, adolescents like to follow a lifestyle trend. This, for example, carries the risk that the adolescent doesn't inform himself properly, whereas On the other side, families who intentionally choose a vegan lifestyle very often deal extensively with the matter and are very much better informed. In different surveys, we find mostly moral and ethic reasons and less health motivational reasons, as we would think as doctors, for the choice of a vegan lifestyle. Also, social and environmental aspects are primarily referred to. In this presentation, I will not be able to address these very important aspects without a doubt. So, when we talk about potential advantages of a vegan diet in children, in general, we can say that vegan diet contains more fibers, folic acid, vitamin C, E, potassium, magnesium, and the very important phytochemicals. On the other hand side, vegan diet is very often lower in fat, and especially in saturated fatty acids, cholesterol, and sometimes as well in calories. Whereas studies on short-term outcome, like coverage of macro and micronutrient delivery, are relatively well performable, studies on health benefits on long-term are much more difficult to perform. There are many confounders having an influence on non-communicable diseases. So are vegans in general, sorry, I was too fast, so are vegans in general more health consciousness, smoke less, have a leaner BMI, and are physically more active. All factors having an influence of these non-communicable diseases and long-term outcome. Moreover, vegan diet is often a negative definition. It tells what is excluded from the diet. However, but what a person is eating could be very heterogeneously, even in a restricted diet, very much depending on the options of the cultural and economical environment. Talking about potential advantages, data are very scarce. In adults, I will show you a systematic review from 2017 with a meta-analysis of observational studies from adults. In different cross-sectional studies, there was a correlation of plant-based diet with a lower BMI, total cholesterol, LDL cholesterol, blood glucose, so overall of the metabolic syndrome. In prospective studies, data are even more heterogeneous. Dino et al. Showed a risk of incidence and mortality for ischemic heart diseases and slightly on the incidence of total cancer. However, it raises the question whether the effect of reduced cardiovascular events and carcinoma is due to the fact that animal products are avoided in a vegan diet, or whether it is contributed to a higher plant food intake. This systematic review from On et al. Published 2017 shows a dose-dependent risk reduction for coronary heart disease, for stroke, total cancer, and all-cause mortality in correlation to daily fruit and vegetable consumptions. These and more recently other publications, as the recent analysis of the, we already heard it from the EPIC Oxford study and the Adventist Health Study 2 cohorts, as well from other results of other diet forms on non-communicable diseases, like, for example, the Mediterranean diet, supports the hypothesis that health benefits base more, not only on the fact that animal-based food are avoided, but on the amount of plant food by food intake. So what about pediatric data? Pediatric data on the effect on a vegan diet are even scarce. A recent published systematic review from Schürmann et al. From Germany could found only 25 publications on vegetarian diet, and only 2 of them based on a vegan diet. Most of the publications came from cohorts studied mostly in the 80s and 90s, where the environment of food supply was different than now, 30 or 40 years later. Most of the samples were very small, some without a control group, and outcomes very heterogeneous in regards of biomarkers, anthropometry, dietary, and nutritive intake. However, for most of the study, growth and body weight was generally within the lower reference range. As expected, intakes of folate, vitamin C, and dietary fiber was higher in vegetarian and vegan food. And one study could show a low vitamin B12 supply in vegetarians and vegans, and 2 studies a low vitamin D. So the author concluded, based on the existing data, they couldn't draw firm conclusions on possible health benefits of such diet forms. However, risks of present-day vegetarian types of diet on the nutrition or health status in children and adolescents couldn't be concluded neither. So let's switch to the other side. What could be the potential risks of a vegan diet in children? Vegan diet very often is lower in calories, saturated fatty acids, and total fat. There are some concerns about protein quality and micronutrients like vitamin D. We heard about B12 already a lot, riboflavin, calcium, zinc, iron, and iodine. I also raised the question, without having an answer, on the impact on a child being what I would call the nutritive exception among peers, not being allowed to eat as the others do. And additionally, the question arises whether restrictive diets serve as a risk factor for eating disorders in adolescents, or, hand and neck, whether people with eating disorders more often choose a restrictive diet. In the next slides, I will go through some of the potential critical nutrients. Protein requirements in young children are, as you know, up to 3 times higher per kilogram body weight than they are in adults. Since vegetable foods have generally a lower energy density and higher amount of fibers, there is a risk of early satiety, especially in the infant. Measures to raise the energy content in meals for infant and toddlers are mandatory. The recommended infant nutrition in vegan diet would be as well breastfeeding. However, as we heard already, if the mother is following a vegan diet as well, she has to check for potential critical micronutrients, as for example is vitamin B12, iodine, and polyunsaturated fatty acids. If breastfeeding is not possible, an infant formula based on soy protein would be the alternative, as for example the ESPGHAN guideline stated already 2006. There are some concerns about soy-based nutrition, as soya is higher in phytate concentration, aluminium content, and phytoestrogens. However, a systematic review published 2014 concluded that in summary, modern soy-based infant formulas would be safe and comparable in regards of growth, bone health, metabolic, reproductive, endocrine, immunological, and neurological functions compared to cow milk-based formulas. Since the protein quality, for example, quantified by the protein digestibility corrected amino acid score, is lower for plant-based proteins, it is important to diversify different vegetable protein sources to avoid possible limiting essential amino acids in different food plants. It is also recommended to increase the daily amount of protein intake for about the factor of 1.3 in early childhood. The peak bone mass is achieved around the age of 25, so the pediatric period is crucial to achieve this individual maximum. There are different nutritive factors influencing bone health. Some of them are well covered in vegan diet, whereas calcium and vitamin D are often critical. Vitamin D is recommended to supplement at least in the first years of life. In Switzerland, it's for the first 3 of life, and then during the winter time, whereas calcium supply has to be optimized by different sources like dark leafy vegetables, nuts, pulses, and as well calcium-rich mineral water. I'm happy that we already heard a lot about B12 metabolism and the importance of vitamin B12 for infants and young children, and that we have experts under us regarding this topic. Just as a repetition, the B12 plays a central role in a vegan diet, since the only reliable source would come from animal-based foods. B12, as we know, is an essential cofactor in different enzymes and is involved in DNA synthesis, hematopoiesis, and myelinization of the brain and nerve system. Clinical symptoms of deficiency in young children are diverse, but most of them show up with refusal of age-appropriate diet, frequent vomiting, failure to thrive, developmental delay, as we heard so far. At a certain point, neurological manifestations are irreversible. There are different options, and we talked about that already this morning, to measure a sufficient cobalamin supply. The most reliable markers, but as we heard, also expensive markers, are the holotranscobalamin 2 in combination with MMA, which would be increased in situation of B12 deficiency. As already mentioned as well, products of animal origin are the only reliable nutritional source of vitamin B12, and cobalamins in algae and seagrasses are often inactive analogues. Therefore, a supplementation in vegan diet is mandatory and obligatory. Since the percentage of the enteral ingested dose decreases with higher doses, it is necessary and as well enough to supplement on a daily manner with lower doses. And in this table on the left bottom, you will find a suggestion of how you could supplement vitamin B12 in young infants. My colleague, Dr. Hasselmann from our hospital in St. Gallen published a series of infants and young children presented to our hospital with clinical signs of severe vitamin B12 deficiency. All of the 8 patients presented in the early 2000s, and luckily, during the last about 5 years, we didn't have such severe cases anymore. Most of them became symptomatic in the end of the first year with psychomotor developmental retardation, refusing of complementary food, and failure to thrive. Most of them had other micronutrient deficiency as well. And these, for sure, are situations which have to be avoided under all circumstances. And unfortunately, we don't have a surveillance system in Switzerland, and I think neither in the other European countries, to such collect cases. So a statement about trends is not possible to me. The main sources of essential omega-3, EPA, and DHA in omnivores stems mostly from different nutrients like, for example, fatty fish. A sufficient intake of omega-3 fatty acids in vegan diet can be critical. As ALA acts as a precursor for DHA and EPA, it can be covered by choosing ALA-rich oils or ALA-rich nuts, as well as DHA-rich alga extracts, which are available on a market. Yesterday we already heard about zinc. Zinc is an essential trace element and cofactor for many enzymes, and clinical symptoms of zinc deficiency range from impaired growth, impaired wound healing, diarrhea, and others. Plasma zinc level can be used as a biological marker. However, it is neither a sensitive marker and can be affected by factors like infection or stress. For other measurements, like for example hair zinc levels, there are no standardized methods. Zinc is found rich in protein-rich foods, both of animal and plant origin, as showed in some examples here at the bottom. However, its absorption can be inhibited by phytic acids. Often higher amount are available of zinc to cover the needs. Iron, finally, has been found to be a critical micronutrient as well in vegan diet. Next to hemoglobin synthesis, iron is involved in neurological functions and therefore psychomotor development. Bioavailability of the plant-based non-heme iron is lower, as you know, than from meat sources, and the absorption can be influenced by different concomitant foods. It can be ameliorated, as you know, with vitamin C or other organic acids, or be reduced by the eating phytates, phosphate, oxalic acids, calcium compounds, and tannins. So in summary, there are many potential critical nutrients in a vegan diet. With a well-planned, balanced, plant-based diet, a coverage of the recommended intake is, except vitamin B12, theoretically possible. Many studies, however, show that in real life, micronutrient and sometimes also macronutrient deficiencies are often prevalent. So there's a gap between theoretical composition and what can be done in real life. This slide is not intended that you can read it in detail, for sure, but what I tried to show you here are some of the recent recommendations of different national societies. Underlined in green, there are more positive conclusions about the recommendation of vegan diets in infancy and childhood, whereas the red ones discourage such a diet form. It is interesting that in general, North American societies supports actively vegan diets, whereas European societies are more conservative. So, for example, the first statement I could find was from the Espegan 2008, where it was discouraged that infants and young children should be fed on a vegan diet, whereas the very often cited publication 2009 from the American Dietetic Association stated that vegetarian, and this included as well vegan diets, would be healthful and nutritionally adequate, and that this form of diets would be appropriate for individuals during all stages of life cycle, including pregnancy, lactation, infancy, childhood, and adolescence as well. The recent publication of the German Society of Nutrition, however, as already mentioned, does not recommend a vegan diet for these life cycles, and this would be the same as Espegan in his last 2017 complementary feeding position paper stated that they would not recommend a vegan diet for these life cycles. So what our report of the Federal Commission for Nutrition concluded was as well that with the current scientific evidence, a vegan diet can't be recommended in a disease preventive optic. This applies especially for infants, toddlers, and adolescents, and during pregnancy and lactation. If, however, people choose a vegan diet, their motivation are in general very strong. And we tried to show or list specific dietary recommendations and supplementations, and we'll briefly can go through it. So this table shows you a summary of practical points to accompany a child fed on a vegan diet. So in general, we would recommend follow-up by a qualified dietitian and pediatrician. We would explore motivation with the family, discuss sources of information, and of course, collect nutritional history, analyze, for example, a 3-day food diary, and do regularly checks, often in infancy and less often once it's stable. And last but not least, discuss different supplements. As already mentioned above, additionally in adolescents, we should explore for any eating disorders. So that brings me back to my practical clinical examples. The mother with her 12-month-old infant, I would explore with her the motivation, and if she would be for any ethical or moral reason, be convinced that she would follow a vegan diet, we would offer medical and dietitian supervision, as discussed just before. A little bit different, the adolescent girl. What are her expectations regarding the restricted diet? Could I manage to build a common disease concept about functional abdominal pain and probably explore alternative, more realistic therapeutic options with the patient? And last but not least, severe malnourished infant. This is an emergency to supplement deficiencies, embed the family in a therapeutic network, and in rare situations, this could lead to child protection measures if the family escapes to cooperate. So let me conclude with the following points. In infants and children, most societies would recommend a mixed, so-called omnivorous, balanced diet. However, if a vegan diet is chosen for any reason we discussed, it is possible, but required a solid knowledge from the parents, should be under appropriate medical and dietetic supervision, and needs additional lab controls and for sure some supplementations. Yes, and sometimes life can be easy, as you see on the menu on the left. Vegetarian plate is French fries with mayonnaise, and the vegan French fries with ketchup. But unfortunately, life is not so easy. So thanks a lot for your attention. I'm really curious to hear what situations in other countries than in the Western world, which the data-based mainly would be. So thanks a lot.
Thank you very much for an excellent overview of the problems, the potential problems, and how you can try to avoid them. So it's open for discussion, and you ask for experiences from other countries. And yes.
Hello. Yes, I'm here. We have in West Bengal a mixed population. Most of us, we take fish, but we have a religious section where the vegetarianism is also not complete. There are certain lentils which they are not supposed to take. My question to you is, very often the child enters it by compulsion. The child is given no choice. Usually it is the mothers, the problem we have with mothers, even if the fathers are non-veg, but if mother is a vegetarian, it very easily rubs onto the child. So I have many families where father is a non-vegetarian, but the mother is a vegetarian, and the child is not given option. So what do you say?
That's the general problem, yes. Children can't choose, so they are dependent on their parents, in your situation, on the mother. How would you resolve that? How do you handle it? I mean, we have situations where we just are allowed, at least in Western countries, to give borders in which limits parents can act freely, and there are some limits where if they go over, then yes, we have to do some measurements, but at least in our society, these limits are really very large on both sides. We just
the problem is if the doctor is a non-vegetarian, because the mother feels insecure. She thinks that she is being robbed of her faith
Question
or belief.
Confidence, yeah.
Yes. So when we have children coming back from Bombay, treatment from Bombay or from some areas of Chennai, they come and tell us, doctor, over there have told every problem you have is because of taking fish and meat. So we are facing this here.
Do you allow me to make a parallel example for Switzerland or for the Western country? I think we have such situation with vaccinations. Parents convinced that vaccination is something dangerous for them. probably this is not a question for areas where you live. So there's no possibilities to talk with this family because they're convinced that this is something going wrong with all the community suggesting such recommendations. This is hard. I don't have an answer for that.
Yes.
Thank you, sir, for your lecture. One thing is that you are talking about the vegan diet in pregnancy can cause microcephaly. In a slide I saw. So what is the mechanism by which it can cause microcephaly? Because we know that nutrition per se does not cause the lowering of the brain volume. It is a chromosomal defect or irradiation or torch infection or Zika virus they can cause. And if the microcephaly occurs, it should be insult on the first trimester of pregnancy, where nutrition does not play a big role. On the second half of pregnancy, usually we are getting the asymmetric IUGR, where brain is spared, but the somatic growth is compromised. So I want to know the mechanism by which vegan diet can cause microcephaly.
Probably it's a misunderstanding. I didn't state that during pregnancy it comes to a microcephaly. That was the example of the child postnatally fed with deficiencies presented with a microcephaly. That was not intrauterine.
Another thing is that B12 encephalopathy. What is the mechanism? We saw one thing, the B12 causing, we are aware of the thiamine deficiency, Wernicke's encephalopathy, but B12 deficient encephalopathy. In a slide we saw.
Okay. Maybe we can look at afterwards. I have an example.
Sir, one thing, what is the vegan is smokeless? You are talking?
But it's just another influence on these non-communicable diseases have to be corrected in long-term studies. If you smoke, the risk of certain cancers is elevated. That applies to that. That these outcomes we measured are influenced by different confounders.
But total amount of cancer is not reduced, you are saying that in vegan diet compared
in this systematic review, not. They are different, but again, the data is not clear.
We have one question.
Very good afternoon. I have one question regarding this vegan diet. That some families in India are absolute vegetarians. They never take any foods of animal origin. So this is also I have seen throughout the world or globe there is few percentage of people are with total vegan diet. So is there any study where it is depicted that this what is about the cognitive development or intelligent quotients of these two groups, separate groups, absolute vegans and those who are non-vegans? Is there any studies there to suggest it is affecting the intelligence?
I think the question here is whether there is an intellectual difference between vegans and vegetarians who are non-vegans.
I think it depends on the potential of the nutrition they have. Yes, if they have chronic deficiency, for sure they will develop. But yes, as I'm trying to show, that depends on the possibilities you have to feed such an infant.
No, whether there is any studies there, is there any study, is there any reported various studies to say about the intelligence of these two groups?
Long term, no.
And one question down there.
You have to keep it pressed.
I was wondering, what is your view for the nutritional composition of vegan food, such as plant milks? Should they try to match in terms of nutritional profile and composition exactly their animal analogs, or should they only contain a good source of those nutrients for which vegans are more at risk of lacking, such as vitamin D, zinc, B12?
Yeah, finally, there are different ways to fulfill this needs of a child. And I don't know whether you refer to different products manufactured or processed for the vegan market, but here we have to keep in mind that processed food, even if they are plant-based, they are not necessarily healthy. So we would recommend the most possible unprocessed food.
Good afternoon. There is a doubt. Some vegan people they do not like this onion and garlic. Has it got any influence on this diet, garlic and onion?
What
The
kind of peppers?
the question is that there are certain groups. These are more not actually vegans. It's a religious thing that they will not touch anything that's grown under the ground. Onions, garlic, root things. Is it going to make any difference?
Are they included in vegan diet or not?
Vegan diet does not mean elimination of roots and tubers. Vegan diet means elimination of anything that comes from an animal. Roots and tuber elimination is part of a religious compulsion.
I just, Ravi, if I could just add on, Sridhar here. Yeah, I think the question here was, see, there is a cult where, I mean, they are called the Jains. They don't have anything from under the ground because they are probably contaminated with microorganisms. So they don't eat anything which is living. So it's a policy that you don't eat whatever is grown under the ground. And the other question that was put forth by that...
Sorry, I'm afraid that you restrict your choice of food much more.
The other question that was put forth by the lady over there was about a concept called nutritional rehabilitation. When you find that your diet lacks certain things, even though it's pure vegetarian, and it is plant-based. For example, if my diet doesn't provide me enough DHA, because there is so much of talk of DHA now and brain development and eye development, so I could substitute it with something that provides a lot of ALA or linolenic acid, which can get converted to DHA. And the implications, because an excess of DHA also can end up with problems like the LDL going up, and you could have a bleeding time which goes up, immune dysregulation, because we don't seem to see the other side of it. We only think about the positive side. So I think that was the first question.
Okay.
And the second one is...
completely agree.
Yeah, and the second one is the concept of hologenome, because now we don't take anything in isolation, we take it with the microbes, and we consider it as the cohesive synergy of the two, providing you all the benefits.
Absolutely, agree. But the question of a simple supplementation is the same as the whole food. Probably not, yes.
Well, I'm Rahman speaking. Well, you are mentioning that purely children who are on vegetarian diet should need additional lab controls and supplementation. Those who are asymptomatic also should be supplemented with all the necessary vitamins and all the micronutrients and whatever being lacking in the non-vegetarian diet.
So your question was whether we would supplement if there's just a low level without symptoms.
Yeah.
Yeah. I mean, as we heard in the B12 deficiency, what is defined by subclinical? So if you talk about bone mass, for example, yes, you will look to very deep with DEXA and etc. whether you already have deficiencies. So yes, we would try to treat subclinical levels as well, or supplement, not treat.
Did lab control also provide lab investigations to know whether they are deficient or not?
For certain micronutrients, yeah. For some, as you know, we don't have very good reference levels, so there's...
No, on a regular basis, who are on vegetarian diet should need lab control, lab investigation, then only to be supplemented, or regularly they should be supplemented?
What he's trying to ask is, if you're a strict vegan, would you give him a multivitamin tonic?
Not necessarily, no. B12, yes, but the others only focused.
I'd like to make a comment. This links to what I talked about yesterday. When you deal with individuals, you have, and I think you pointed that out, especially it's true in the Indian context, you have to respect where the parents are coming from, because if you're going to go at odds with them, then at the end, no one is going to benefit. The issue is to be aware of what are the nutrients that could be at risk. We're really talking about young children, so it's very different. You can be strictly vegetarian. It's probably good for you to be strictly vegetarian once you cross the age of 40. But for a growing child, I liked your first slide, which said, the risks are higher for very young children and diet. So what's needed, what I'm hearing, is a little bit more of knowing what are alternate sources. And if indicated, there are some nutrients People don't have, as far as I know, have no problems giving supplements. And I've often argued with some folks, the first food that the child gets is an animal product, which is breast milk. So, I mean, I'm being extreme here, but the point is, I agree with the physician who said there is the bias, right? The parent says, you don't eat, you're not a vegetarian, so you don't understand, you're not trying to push that on me. That's when we get into trouble. It needs to be a little factual based and said these are the risks and find solutions. But that becomes in that interpersonal counseling, and that's what I take away from this.
Yes.
I just needed a little bit more about the soya. Okay, there is so much spoken about soya and phytoestrogens, soya and the isoflavones like gemistein, soya and a little bit of feminine tendencies, promotion of estrogen-based tumors, protection of prostate cancer because again it's estrogen dependent. So do you really feel, because these are things that are being dumped into our country, and do you really think that there is a problem with soya which is covered up? Because we tend to extrapolate all data. See, all the Western data is, and we are genetically totally different.
For sure, I can't answer this concrete answer regarding the different ethnicity. I think it comes back again to the quantity. So if you feed your child in the first month with a soy-based formula, and then start with complementary food and diverse, it's probably not the same as if you just have for years soya-based nutrition. So yes, if you can diversify, it would
because the scare is the neurobehavioral changes that are being proven in rats and animals. So you have neurobehavioral changes, you have the isoflavones with all possible effects on rats, but then they say it doesn't work on humans. But it's a little bit apprehensive. I mean,
can't answer that. Yeah. Don't know.
Any other questions, comments?
Yeah. My question is, sir, like if we are doing a study between vegans and non-vegans, and there are many confounding factors like vegans generally are non-smokers, non-alcoholics, then how we remove these confounding factors, like for a study for cancer, whether vegans are less cancer, like how we remove these confounding factors?
By having enough big groups and controlling for these factors, if they are known. Yeah, for the well-known you can control. For the not very well-known, it would be still confounders you have. And again, these are studies, if you talk now about cardiovascular disease and carcinoma, which has to last long, very long.
Other questions? Then we will proceed. Thank you very much.